You took care of the MCAT, personal statement, volunteering, research, extracurriculars. Seems like everything, right? Wait, have you heard of the Casper Exam? It's a situational judgment test required by many medical schools after your primary application. If you're thinking, what even is Casper? I've never heard of it. Who needs it? How do I prepare? Well, this video is for you. We'll walk through everything that you need to know about the Casper Exam, plus a mental roadmap that you can have to build your confidence and boost your score. Hey everyone, welcome back to my channel. This is Montu Med, currently a third-year medical student hoping to shed some light into the premed and medical school application process. In this video, we'll cover everything you need to know about the Casper Exam. I've watched every single YouTube video, listened to every podcast, and went through a ton of Reddit to summarize everything I found in this video. Okay, so what is Casper? Casper stands for Computer-Based Assessment for Sampling Personal Characteristics. It's an online situational judgment test, an SJT if you will, designed to test your non-academic yet essential characteristics that schools are valuing for medical school success. Things like empathy, ethics, communication, professionalism, problem solving, collaboration, equity, resilience, all of that. This test was actually created in Canada, but now is being used globally to test how you would respond under pressure beyond just what you know, making it a crucial tool for evaluating applicants for medical schools holistically. So what schools require Casper? There's over 30 MD and DO programs that require Casper in 2025. Some of the examples might be Baylor College of Medicine, Boston University, Drexel, Hofstra, New York Medical College, Michigan State, Texas A&M, Temple, Rutgers, Colorado, Nevada, and more. I feel like more and more schools are adding onto the list every single year. Pro tip, always check each school's admissions website and use the QD platform for the most current and accurate list. Okay, some of the logistics behind the Casper Exam. The base fee is $85, and this includes distribution of the results to 7 to 8 schools. Additional schools might have charges of $16 to $18 per school, and you get 1 attempt per application cycle. Rescheduling accommodations are possible, but there may be added fees to that. So when do most people take it? Typically from April to June. It takes about 2 to 3 weeks before you get your results back, and ideally you would want to have this done before submitting your secondary application. Schools need this to have your application considered as complete and to reward you with interviews later on in this process. So what is the format of the Casper Exam? It's an online exam. You take it at home with a webcam and a microphone using Acuity Insights. That's the website that you'll be using, and it takes about 65 minutes to 85 minutes, depending on how many breaks you take. What is the exam format and question types that you might be seeing? There's 2 parts. One is the video responses. They actually piloted this when I first took Casper myself 4 years ago now. This includes either word or video-based scenarios that they give you, and then you have to answer 2 questions per scenario, a minute per question, recorded live. In other words, you can talk out loud and respond to the scenarios that they give you. And then part 2 is a typed response. This part you're not talking out loud, you're going to be physically typing in on your computer answers to the questions. So there's 7 scenarios, either a word-based scenario or a video-based scenario that they give you, and there's 2 questions for each scenario, and you get 3.5 minutes total per scenario. You're unable to go back between sections and edit your answers. There's an optional 10-minute break between video and the typed portion, and then another 5-minute break if you want between the typed prompts. And the scenarios can include day-to-day team conflicts, ethical dilemmas, and communication challenges, for example. Question you might see come up might be, a patient is asking for strong painkillers, but a nurse warns that they might be seeking drugs. What may be going on through your head? How would you handle this situation? Okay, how is this scored? Each video scenario is scored by 1 rater. Each type scenario may be scored by different raters. The scores are then normalized and standardized into quartiles, and you get 1st, 2nd, 3rd, or 4th for your grade. You want to be aiming for the 3rd or the 4th quartile to be considered competitive for this part of the application. And your final results are sent directly to the medical schools as long as you paid for them. So what can you use to prepare for this exam? The website that you take the exam on, Acuity Insights, that is the official platform, and they have a free practice test that you can take. They also have guidelines and video tutorials. There are also third-party resources online that you can use, including websites that include practice scenarios and mock answers that you can try to emulate and try to get a framework to base your answers on. What I would suggest is using AI to give you a prompt, as many as you want, and talking back and forth with the AI to tweak your responses. This is probably what I did the most, was just looking up random ethical scenarios and typing out as fast as I can the answers that I would give personally. And this part is very important. You want to practice as many scenarios as you can and work on your typing. You want to simulate testing conditions as best as you can. Use a quiet, distraction-free area. Use the actual hardware that you might be using on your exam, the webcam and your microphone that you'd be using. Use the same ones. You don't want to be used to one equipment, having to change another, and have it not work the day of the exam. You don't want to have to panic during the exam. And then actually time yourself and watch these videos back. Get 1 minute for the video prompts and 3.5 minutes for the typing scenarios. Okay, what is a framework that you can try to use to answer Casper questions? Think about these words: clarify, consider, and then communicate. So for clarifying, always try to get as much information as you can before you proceed with the response. Always ask more questions, ideally open-ended questions to the other party. Try to get in all the information, then digest the information, and then analyze and provide a response based on the information that you might have acquired that was not already included in the scenario. Since they might not give you more information in the prompt, give yourself hypothetical situations saying, if the person says this, then I would respond this way. If the person says this instead, I would respond that way. 2. Consider. This is where you're thinking about 2+ reasonable responses. So with the example of the ideal situation, and if there was a non-ideal situation, how you would respond that way. Once again, the if-then format. And then 3 was communicate. You want to be empathetic, you want to be responsible, and you want to be reflective. So use stems like, I understand you're upset. What I would do is so-and-so because so-and-so. And always make sure you're not going past the limits of your role. If you're a volunteer, seek out help from a supervisor or a professional. And reference ethical guidelines if they're relevant to your question. Mention things like autonomy in your prompt. And then never blame other people or other parties involved. Take responsibility of the actions. And then always communicate over doing nothing else or assuming. So what are some of my own personal tips and tricks that I would recommend before you take the Casper? 1 was practice my typing. It is as much as a typing test as it is an ethical-based scenario test. So I want you to go online, look up typing exercises, look up typing speed tests, get your hands ready for the exam, and work on your typing speed. You're more likely to run out of time than you are to run out of ideas to talk about in these responses. 2, I did some research into the 4 main medical ethical principles and tried to emulate those in my responses. And 3, just throw out buzzwords everywhere. So speak with each party individually in a private, non-judgmental setting. Buzzwords like these can easily inflate your score and give you a chance at a higher percentile. Okay, mastering Casper isn't really about perfect responses. It's more about demonstrating maturity, empathy, and clarity with your responses. Once again, typos do not matter, so don't worry about your spelling. Just make sure you type down everything that you want to say. If you're blanking on a situation, make if-then statements. Give like 5 possible scenarios and talk about how you would do each. Make a pro-cons list for each approach you might be taking. These are just some of the tips and tricks that I followed if I didn't know where to start with a question, and if I was blanking, I would just do this until I had other ideas that come into mind as I was typing. If you're able to get a 3rd and 4th quartile score, that's perfect. If not, it's okay. You're still in the running for the med school process. Hopefully this video gave you everything that you need to know about the Casper exam. Don't panic if you didn't do too well on this exam. There's so many other parts of the application. It is a holistic application after all. There are many other aspects that are weighed potentially a lot heavier than this. As long as you're being a normal person and not being a psycho in your responses, I assure you, you'll be okay. Good luck with your exam. Let me know if you have any comments below. If you like the video, like the video. If you dislike the video, dislike the video. It's been Montu Med. Thank you so much for watching, guys. Take care.